Okay, let's just dive right into this. Welcome to The Explainer. Today, we are unpacking a truly chilling, real-world medical mystery. Picture this, all right? It's April 2026. A luxury cruise ship packed with about 150 people from 23 different countries sets sail for what is supposed to be the absolute trip of a lifetime, to Antarctica and the remote islands of the South Atlantic. For the first few days, everything is perfect. People are socializing, partying, enjoying the incredible ocean views. But beneath the surface of this dream vacation, an invisible killer has already boarded the ship. What happens next turns this luxury liner into a literal floating nightmare. And solving this mystery? Well, it's going to require us to untangle decades of medical history.
April 2026 cruise ship outbreak. April 1st, the ship departs Ushuaia, Argentina. April 11th brings the first mysterious death. By April 26th, we have a second death after a medical offload. And on May 2nd, the WHO is officially informed. So imagine the horror unfolding here. Just 5 days into the trip, a 70-year-old Dutch passenger suddenly develops a fever, a severe headache, and mild diarrhea. He visits the ship's doctor, but within a day or two, the poor guy can barely breathe. His condition deteriorates so rapidly that by April 11th, he dies right there on the ship, and nobody knows why. The passengers, totally unaware of the danger, they just keep socializing. Then, on April 24th, the ship docks at an island near Africa. The deceased man's wife disembarks with his body, travels to South Africa, and is literally about to board a flight to Amsterdam when she suddenly collapses. By April 26th, she's dead too. Meanwhile, back on the ship, a German woman falls terribly ill and dies just a few days later. One by one, passengers are dying. Finally, on May 2nd, the World Health Organization gets the call about this terrifying crisis.
Diagnosis? Hantavirus, a 70-year-old killer with no vaccine and no known cure. Tests are rapidly conducted, and the diagnosis that comes back absolutely shocks everyone. It's the hantavirus. Now, what's really terrifying about this is that it isn't some novel, never-before-seen pathogen like we might expect. No, this is a deeply entrenched killer that scientists have known about for 70 years. Yet, despite 7 decades of intense research, there is absolutely no FDA or WHO-approved vaccine. There isn't even a proven antiviral treatment. If you get infected, doctors can pretty much only offer supportive care to relieve your symptoms. But ultimately, your immune system has to fight the battle entirely on its own.
50%. And that battle is incredibly steep. The mortality rate for this virus can reach up to 50%. Let that sink in for a second. Half of the people who contract this illness could die from it. That is the terrifying reality the passengers on this stranded ship were suddenly facing, and frankly, it's what makes our medical investigation today so high stakes.
HFRS versus HPS. HFRS, found in Asia and Europe, causes kidney failure and internal bleeding. HPS, found in the Americas, causes lungs to fill with fluid, leading to suffocation. To understand how this virus kills, we really have to look at how it attacks the human body. The hantavirus is actually a whole family of viruses, and it primarily causes 2 brutal types of illnesses depending on where you happen to live in the world. First, we have HFRS, which mainly strikes in Asia and Europe. This variant aggressively attacks the kidneys, causing them to completely fail and leads to severe internal bleeding. Then, we have HPS, the variant found over in the Americas. This one targets the respiratory system. It causes the lungs to rapidly fill with fluid, essentially causing the patient to suffocate from the inside. Both are absolutely devastating. But to understand exactly where this virus came from, we need to transition into medical detective mode and crack open our first cold case.
Cold case number 1, the Korean War, 1950s South Korea. 3000. Let's travel back in time a bit. American soldiers are fighting in South Korea when a mysterious, invisible enemy strikes the ranks. Over 3,000 soldiers suddenly fell ill with this bizarre sickness. It started with high fevers, severe headaches, and vomiting, and then their kidneys just shut down. Around 15% of those infected died. At the time, military doctors called it Korean hemorrhagic fever, and they were completely baffled. Was it a natural disease? Was it some kind of chemical weapon? It took nearly 30 years to solve this mystery. Finally, in the 1980s, a brilliant South Korean virologist named Dr. Ho Wang Lee identified the culprit. It was a virus carried by rodents. He named it the Hantavirus, after the Hantan River that flows through North and South Korea.
Moving right along to cold case number 2, the Navajo Nation, May 1993, in the American Southwest.
The ecological chain reaction. Step 1, El Niño brings heavy rain. Step 2, a bumper crop of piñon pine nuts. Step 3, a massive explosion in the mice population. And Step 4, a rampant viral outbreak in humans. Now, back in 1993, in a matter of just weeks, 10 perfectly healthy young people died suddenly from a flu-like fever that filled their lungs with fluid. We're talking a staggering 75% initial mortality rate that completely stumped scientists at the CDC. But this brilliantly illustrates how indigenous knowledge can solve incredibly complex mysteries. Tribal elders explained a very specific ecological chain reaction. When the El Niño weather pattern brings heavy rain to the region, it causes a bumper crop of pinyon pine nuts. Well, these nuts are the absolute favorite food source for local mice. With all this abundant food, the mice population absolutely explodes. And more mice mean vastly more contact with humans, leading directly to a rampant viral outbreak. When scientists finally tested the local mice, they found the exact same virus. It was a brand new strain of Hantavirus, driven entirely by this ecological chain reaction.
Let's look closer to home, the Indian context, a silent presence in Tamil Nadu. We have some really fascinating data here. For the general public, with a low exposure risk, we see about a 4% positive rate for antibody presence. Warehouse workers who have a high risk show elevated presence. And the Irula tribe, the traditional rat catchers with a very high exposure risk, also show elevated antibody presence. You see, the hantavirus isn't just an isolated threat in the Americas or Korea. It has a silent presence globally. This was a major multi-institutional study conducted between 2005 and 2008 in the Vellore district of Tamil Nadu. Researchers tested over 600 people across different risk groups for hantavirus antibodies. Now, antibodies are proof that a person was previously infected. And look at this, even among the general public with low exposure risk, about 4% tested positive. The virus was already silently spreading. And for warehouse workers and the Irula tribe, whose members actively work as rat catchers, the presence of antibodies was significantly elevated. It confirmed that people living or working closely with rodents are actually getting infected all the time, without it ever making global headlines. If hantavirus comes from mice, how did it spread between passengers on a luxury cruise ship in the middle of the ocean? Up until a certain point in history, scientists believed hantavirus only spread directly from rodents to humans. It did not spread from person to person. Which brings us to this massive, glaring question. If it comes exclusively from mice, how on earth did it spread between human passengers completely isolated at sea? Andes virus, a specific strain of the Hantavirus family from Argentina, uniquely capable of confirmed human-to-human transmission. And there it is. The answer lies in a massive plot twist discovered in southern Argentina back in 1996. The Andes virus. This is a very specific, unique strain of the Hantavirus family, and it holds a terrifying distinction. It is the only variant in the entire Hantavirus family with confirmed documented human-to-human transmission. It breaks the mice-only rule completely. How the Andes strain spreads. It requires close, prolonged physical contact. It's spread through sharing beds or bodily fluids. There's high risk for those caring for infected individuals. It's driven by rare superspreaders, and it features an extremely short transmission window of approximately 1 day. So, how does this actually help us understand the cruise ship outbreak? Well, the good news is, it's not airborne like the flu. It requires really close, prolonged physical contact. We are talking about sharing a bed, encountering bodily fluids, or being a caregiver who is in very close proximity to a sick person. Interestingly, scientists have noted that some infected individuals act as superspreaders, transmitting the virus to a disproportionate number of people. But here is the most fascinating biological quirk of the whole thing. The transmission window is incredibly short. An infected person is typically only contagious for about a single day, right at the onset of their illness.
Ground Zero, a Dutch couple's bird-watching excursion near a rat-infested landfill in Ushuaia. And that biological quirk we just talked about, that solves our cruise ship mystery. Do you remember the 70-year-old Dutch passenger who was the very first to die? Well, before boarding the ship in March 2026, he and his wife went on a bird-watching excursion in Ushuaia. During this tour, they accidentally wandered near a rat-infested landfill. This right here was Ground Zero. Because the transmission window is only about 1 day, if they had boarded the ship a few days later, the virus likely wouldn't have spread to anyone else. But they boarded that cruise ship precisely within that tiny, highly infectious 24-hour window, bringing the deadly Andes strain directly into the enclosed environment of the ship and passing it to others.
Cruise ship aftermath as of May 10, 2026. 10 total confirmed cases, 3 fatalities. 4 patients hospitalized globally in South Africa, the Netherlands, and Switzerland. 2 Indian crew members quarantined with no symptoms. And the ship finally docked in Tenerife, Spain. Bringing our opening story full circle, the aftermath of this specific cruise was just devastating.
4 patients had to be medically evacuated and hospitalized in ICUs all over the globe. 2 Indian crew members were quarantined, though thankfully they never developed symptoms. And after being rejected by multiple countries, the ghost ship was finally allowed to dock in Spain, where an extensive evacuation and testing protocol began.
Is hantavirus the next global pandemic?
Now, hearing a story like this, especially after the last few years we've all had, naturally triggers the elephant in the room. It's the primary fear on everyone's mind right now. Is this going to be the next global pandemic?
Hantavirus versus COVID-19. Hantavirus is not airborne, requires close contact, and has an incredibly short one-day transmission window. COVID-19 is highly airborne with a 14-day transmission window. Okay, let me just de-escalate the tension right now. The World Health Organization has assessed the global risk as low, and a quick comparison here shows exactly why. We all know a virus like COVID-19 is highly airborne and has a long transmission window of up to 14 days, making it incredibly easy to spread across the globe. But hantavirus? Even with the Andes strain, it is not airborne. It requires intense, close physical contact. Plus, that incredibly short one-day transmission window acts like a natural firewall. If an infected person simply isolates for a couple of days, the chain of transmission is entirely broken. So a massive global pandemic of hantavirus? It's highly, highly unlikely.
Your defense: actionable prevention and hygiene.
Preventing infection. Seal all gaps in your home to keep rodents out. Wear N95 masks and gloves in dusty storage rooms. Carefully dispose of garbage and clear food sources. And be highly vigilant around rodent droppings. Now, unlikely does not mean zero risk, especially considering that terrifying 50% mortality rate and the fact that changing weather patterns like El Niño can cause rodent populations to randomly explode. Since there's no vaccine and no cure, your awareness is absolutely your best weapon. First, inspect your living space and seal all gaps. Do not let rodents get inside. Second, if you are cleaning out a dusty storage room, an old garage, or a warehouse, throw on an N95 mask and some gloves. The virus can actually become aerosolized from dried rodent droppings when they get disturbed. Third, maintain strict hygiene. Carefully dispose of your garbage and do not leave food sources sitting out in the open. And finally, if you do see rodent droppings, be highly vigilant. Use wet cleaning methods with disinfectants rather than sweeping, because sweeping just kicks all that dangerous dust right up into the air.
The hantavirus has been hiding in the shadows for 70 years. What other invisible threats are we unknowingly living alongside today? We've seen how a changing climate, a rat-infested landfill, and a tiny one-day transmission window turned a luxury cruise into a fight for survival against a 70-year-old medical mystery. The hantavirus has been quietly hiding in the shadows, silently infecting people for decades before making dramatic global headlines. It really makes you wonder, doesn't it? What other invisible threats are we unknowingly living alongside today? Keep questioning, keep learning, and as always, thank you so much for joining me on this explainer.